Airway management.
Hello, I'm Angie Lomelli and I am an EMS instructor. I'm presenting you with a series of EMS educational videos. Now, whether you are a first responder, a student, or just someone simply interested in learning more about the wonderful world of EMS, these videos are for you. Now, the videos are made so that you may watch and follow along as well as practice while watching. Hopefully, you'll find these videos helpful during your lab skills and testing. Good luck with your venture, and let's get started.
Performance objective. Rescuers will demonstrate their ability to manage a patient's airway. Taking more than 15 minutes is a fail for this skill. Conditions. An airway management trainer mannequin, various ventilation devices, and adjuncts are provided to the rescuer. The rescuer may inventory equipment and prepare items for easier access before beginning the skill.
Equipment. Airway bag. Suction unit. Airway mannequin. Airway bag contents. Oxygen tank. Regulator with flow meter and PPV. O2 wrench, toggle on tank. CPR pocket mask. Nasal cannula. Non-rebreather mask. Nasopharyngeal airways. Oropharyngeal airways. Bag valve mask. Adult, child, and infant. Set includes BVM body, mask, O2 tubing, and reservoir bag. Endotracheal tube set. Thomas tube holder with modified ET tube. Rigid suction catheter, with or without a hole. Flexible suction catheter. Personal protective equipment.
I wanted to take a moment to talk about personal protective equipment. Besides wearing goggles, gloves, and a respirator, when dealing with airway management, it's important for you to use a face shield because it offers direct splash protection. You just never know when a patient will sneeze, cough, or due to excessive fluids in their mouth, they may end up spraying when they speak.
Note: when dealing with airway management, it's important to use a face shield whenever possible. Perform penman. The skill will begin when the rescuer states, "I would perform penman," donning gloves, goggles, respirator, and face shield. Medical grade oxygen administration, regulator assembly.
O-ring, gasket, oxygen tank and regulator, wrench.
What I am about to show you may not be something you will practice in class or even be tested on. However, it is important to know that sometimes you will find dust or debris in the orifice of the oxygen tank. To clear it out, you take your wrench and you're going to simply open it up for a quick second and then shut it. Make sure it's not facing you or anyone else. When assembling the oxygen tank, be sure to keep one hand on the tank at all times. With the opposite hand, take your regulator. Make sure that the inside of the regulator has a rubber gasket.
Sealing O-ring washer, brass and rubber gasket.
Take the regulator and slide it down. Align the pins with the holes. Some students will overestimate and end up at the bottom of the neck. Be sure that everything is flush. Turn the handle. And now that it's tight, make sure you have it at 0. Turn the gauge away and take the wrench. Righty-tighty, lefty-loosey. So we're going to go round until it's completely open and then a quarter turn back. I will take this off and then I will report to my proctor how many pounds per square inch there is. And I will state this has 1700 psi. It is important to listen for any hissing sounds from oxygen that may be escaping. In addition, a tank with 500 psi or less should be taken out of service immediately. Once you have finished assembling the oxygen tank, let it rest on the airway bag so that you have access to the ports and the flow meter.
Rescuer stands up oxygen tank and holds it with one hand on the tank at all times for safety while assembling the regulator. Checks the regulator for a rubber gasket, O-ring. Fits regulator pins into the ports of the neck of the oxygen tank and tightens securely. Note: do not over-tighten. Rescuer uses a wrench or uses the tank toggle to open oxygen tank. Assures the regulator gauge is not facing anyone. Opens valve by turning left, counterclockwise. Opens the tank all the way, then turns back 1/4 turn. Checks for leaks. Listens for hissing noise. Examines the pressure gauge for PSI, pounds per square inch. Rescuer states the gauge shows blank PSI, actual tank pressure. If the tank has less than 500 PSI, I will take it out of service and replace it with a full tank, 2000 PSI. Lies the oxygen tank back into the airway bag.
Nasal cannula and airway mannequin. Oxygen tank.
I will connect the nasal cannula to the regulator and set the flow meter between 0 and 6 liters per minute.
Turn off while training in class.
A nasal cannula can be applied to a patient who is sitting, standing, or lying down. Please note there's a natural curvature on some of these cannulas, and there's a little tab that should rest in the middle of the upper lip area. There's also a moving part here. It's used to tighten around the patient's mandible area. You can also loosen it. So, taking it with the curvature, these will be inserted in each nair. Put this over each ear, and then you may tighten it by cinching it up. If the patient is lying down, place the cannula in each nair, go around both ears, and tighten for comfort.
Rescuer selects nasal cannula and attaches it to the flow meter nipple, tree, on the regulator. Selects liter flow rate between 1 and 6 LPM, liters per minute, and listens for airflow. Places cannula on patient. If the cannula has a flip tab, let it rest on the upper lip and place the flared or straight nasal prongs inside the nairs. Secures the thin tubing over each ear and cinch the sliding fastener under the mandibles. For breathing patients, non-rebreather mask, high flow oxygen.
Non-rebreather mask and airway mannequin. Oxygen tank.
This is a non-rebreather mask. What you want to do is understand how it operates. The oxygen will flow through this tubing and enter through this area. There is a valve here so that the air only flows out and no air will go back in. That's why it's called a non-rebreather. For safety, you're going to remove one of the flaps. This is the flap. However, the manufacturer created these for EMS, pre-hospital rescuers, and there is no little peg, so therefore there is no ability to put in the flap here. It's automatically set up that way. But you will find some with 2 flaps, remove one. In addition, this part here is a aluminum strip that you can mold around the patient's nose. And this is an elastic strap that you can use to pull and tighten around the patient's head for comfort, so that way you don't have to hold it. Last but not least, we have this area where the bag will fill up with oxygen. To get this going, you'll get the connector at the very end, insert it, flow the oxygen between 10 to 15 liters per minute. I'm going to put it at 10. That's usually more than enough. I'll put 2 fingers to allow the bag to fill up. Once the bag is full, I'm ready to place it on the patient.
Turn off while training in class. Set flow meter to 10 to 15 LPM.
Now I will take the non-rebreather mask and make sure that it's expanded as much as I can first. Place it over the patient's nose and mouth. I'll put the band over their head, and then I could pull the elastic strap to make sure that it's form-fitting around the head and it doesn't fall off. I will mold the top aluminum strap around the nose, again ensuring that I only have 1 flap on, and then I will report to my proctor that I'll be watching the bag deflate on inhalation and inflate on exhalation. In other words, the bag will collapse and shrink when they breathe in, and the bag will expand when they breathe out.
Rescuer selects NRM and attaches to the flow meter nipple on the regulator. Selects liter flow rate between 10 to 15 LPM and fills the reservoir bag by closing valve with gloved finger. Removes one of the valves for safety and places the mask on the patient. Places apex of the mask over the bridge of the nose and molds the aluminum blade over bridge of nose. Pulls elastic straps to tighten the seal of the mask onto the patient's face. Rescuer states, I would remove 1 mask flap for safety, and I would observe the reservoir bag for deflation on inhalation and inflation on exhalation. Airway adjunct oropharyngeal airway for unconscious patient without gag reflex.
Oropharyngeal airways, airway mannequin.
Now we will insert the oropharyngeal airway, or OPA. You'll need to select the correct size for your patient. To determine this, you're going to place the distal end at the tip of the earlobe, follow the curvature of the jaw, and this is the bite block. So you want the corner of the mouth at the mid-bite block.
Mid-bite block.
That technically coincides with where the teeth will rest on the bite block. You hyperextend the patient's head back. You're going to enter upside down so that it taps on top of the roof of the mouth, avoiding the tongue. Then you're going to turn 180 degrees and you're going to slide over the tongue. Avoid pushing the tongue down. Now, to determine that you have not lost or impeded or caused any obstruction on the airway, you're going to want to assess the chest for breathing for about 10 seconds. And you're observing 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, 6 1,000, 7 1,000, 8 1,000, 9 1,000, 10 1,000.
Rescuer selects the OPA that will fit the patient, places distal end of OPA at patient's earlobe, and measures the mid-bite block to the corner of the patient's mouth following the curvature of the jaw. Opens patient's mouth using head tilt chin lift maneuver per AHA. Rescuer hyperextends the patient's neck while inserting the distal end of the OPA up into the roof of the mouth halfway. Rotates the distal tip of the OPA 180 degrees and inserts it further down until the bite block rests at the teeth. Looks for breathing by observing the chest rise and fall while maintaining head tilt with hand. Rescuer counts aloud 1 1000, 2 1000 for no more than 10 seconds. Airway adjunct, nasopharyngeal airway for conscious patient with gag reflex.
Nasopharyngeal airways. Airway mannequin.
Now we will insert the nasopharyngeal airway, or NPA. We're going to select the best size that fits the patient. To do so, you will measure from the distal end of the NPA, that is the beveled end, to the tip of the earlobe, following the curvature of the jaw, and to the tip of the nose. What you're not going to do is you're going to get something very small and try to stretch it and make it fit. You want to avoid doing that. You want it to have its normal shape, go from the tip of the earlobe to the tip of the nose. Once you've determined you've got the length, you want to make sure you have the widest circumference that fits the nair. In this case, it is designed to go into the right nostril. We are going to lubricate the tip by applying a little bit of this. This is a special type of lubricant for this specific mannequin. In the field, you'll be using something like KY jelly or other solutions that are available. Now that I have lubricated the tip about 2 inches, I will hyperextend the patient's neck and head, and I will insert it so that the beveled end is medial to the septum, right here, straight across. You're going to push it in, and you might have to shimmy it a little bit just to allow the lubrication to coat the mucous membrane inside the nair and avoid any tearing. You might want to enter very slow and not push it in. And there might be a couple times you might pull it out or just slightly twist it, but whatever you do, you're not going to be twirling it around. Let it rest here. And basically you're going to assess for breathing once again to ensure that you have not caused an obstruction or impeded the airway. And you're going to count to 10 seconds while observing the chest rise and fall. 1 1000, 2 1000, 3 1000, 4 1000, 5 1000, 6 1000, 7 1000, 8 1000, 9 1000, 10 1000. Rescuers, when you are practicing with the mannequin, be sure to have a paper towel or napkin available so that when you spray, and if you miss or you do an excessive amount of spraying, it's not going to go all over the furniture, all over your mannequin, on the floor, on the carpet. Keep it isolated to just the 2 inches on the tip, and from this directly onto the mannequin. I wanted to take a moment to communicate a disclaimer. Some of the textbooks will show the image of how to measure this in the opposite direction as we do it in class. For the purpose of this skill, we are measuring the distal end of the OPA to the tip of the earlobe, following the curvature of the jaw, and the corner of the mouth should be at the mid-bite block, which is depicted by this white line. The publications will show an image in the opposite direction. In either case, the measurement is still the same. With the NPA, we are measuring from the tip of the earlobe to the tip of the nose, following the curvature of the jaw. However, the publications will show it in the opposite direction. The measurement does not change.
Rescuer selects the NPA that will fit the patient, places distal end of NPA at patient's earlobe and the flange at the tip of the nose following the jaw curvature. Note: do not stretch NPA between nose and ear. Determines the correct length and largest diameter of airway that will fit into the right nostril. Lubricates distal end of NPA about 1 to 2 inches over absorbent tissue in class. Rescuer hyperextends the patient's neck while inserting the beveled end medially into the nair, with a slight shimmy or minimal rotation. Rest flange against the nair. Look for breathing by observing the chest rise and fall while maintaining head tilt with hand. rescuer counts aloud, 1 1000, 2 1000, for no more than 10 seconds. BVM, select the correct size, 15 LPM.
Oxygen. BVM. Airway mannequin.
Connect the BVM tubing to the regulator and then set the flow meter to 15 liters per minute. You do not have to wait for the bag to fill up before you use it.
Turn off while training in class.
Hyperextend the head and insert the OPA. Ensure that you have the correct size mask, one that will fit the face. The apex should be at the bridge of the nose and the bottom base should be between the bottom lip and chin. This one fits. Do a CE clamp with your index finger and your thumb, putting pressure straight down on the mask. The remaining fingers should be on the mandible. Further hyperextend the head, and you're going to give one breath every 5 to 6 seconds, making sure that each breath is about a second long. All you have to do is squeeze with your thumb and your 2 middle fingers lightly, and do not overinflate the lungs. It'll look something like this. You ventilate and count. 1 1000, 2 1000, 3 1000, 4 1000, 5 1000, 1 1000, 2 1000, 3 1000, 4 1000, 5 1000, 1 1000, 2 1000, 3 1000, 4 1000, 5 1000. And you're observing for the effectiveness by the chest rise and fall. And you will continue doing it until your proctor stops you.
Rescuer positions self at the patient's head. Note, patient's head may be between the rescuer's knees in the field. Inserts the airway adjunct NPA or OPA with the proper technique. Assembles the BVM and attaches the proper sized mask. Attaches the oxygen tubing to flow meter and sets it to 15 LPM. Applies the mask onto the patient's face while using the CE technique. Rescuer places index fingers over base of mask and places thumbs over apex of mask with remaining fingers under mandible. Use a downward push on the mask and upward lift on the mandible to maintain hyperextension of neck. Ventilates patient in a smooth and rhythmic fashion, delivering each ventilation over 1 second long. Rescuer delivers ventilation at the rate of 1 breath every 5 to 6 seconds, counting aloud. Breath, squeeze BVM, 1 1000, 2 1000, 3 1000, 4 1000, breath, squeeze BVM. Performs several rounds until stopped by scorer.
Battery-operated suction unit. Rigid and flexible catheter. Airway mannequin. Suction unit. Rigid and flexible catheter.
The battery-operated suction unit comes with a canister, the battery suction device, as well as the suction tubing. You may need to assemble it ahead of time. This port will go in here to create a vacuum. Your suction hose will go into the image that states patient to canister. And this end will be connected to the catheter. There are 2 types of rigid catheters, one without a hole and one with a hole. The one with a hole will only work when you cover it, it will suction. The one without a hole will be on a continual suction cycle. I'm going to use this one today. First, I need to connect my suction tubing to the catheter. And now I'm going to turn it on to check for patency on my line. And I'm going to listen for the change in the motor sound as well as the suction sound. I'm going to shut it off for now just so that you can hear me better. I will then measure from the tip of the earlobe to the corner of the mouth. Ironically, it is right here at the tip of the bend. I will not go any further than that point. I'm going to go in without suctioning. Now I'm going to turn on my machine and suction only on my way out in a circular motion. No more than 15 seconds for an adult, no more than 10 seconds for a child, and no more than 5 seconds for an infant. If the patient were to vomit, I would roll the person over and clear their airway with my finger. At this point, I would hyperoxygenate the patient after suctioning. Now I will demonstrate the use of the flexible catheter. You should already have the suction tubing on the canister, and you will get the opposite end and connect it to the flexible catheter. You're going to test for patency by turning on the machine and crimping the hose and listening for the change in the motor as well as the hissing sound as it suctions. Normally, I would leave the suction unit on, but for the sake of audio, I will shut it off for now. You will measure the flexible catheter from the tip of the earlobe to the corner of the mouth, and you will not go in any further than that. You're going to enter without suctioning. At this point, you would cover the hole and suction in a circular manner on your way out. And you need to state that you would not suction more than 15 seconds for an adult, no more than 10 seconds for a child, and no more than 5 seconds for an infant. You would consider a log roll if the patient were to vomit, and you can clear the airway with your finger. And after suctioning, you would hyperoxygenate.
Rescuer presents all 3 catheters and checks for the presence or absence of an opening, a hole, that must be covered to initiate suction. Rescuer may explain the difference in how each one functions based on the hole or absence of a hole. Selects a catheter and connects it to the tubing. Rescuer turns on battery-operated suction unit to test patency of suction by crimping the tubing and listening for a change in the motor and the suction sound within tubing, or by observing pressure display lights. Rescuer may use sterile water or saline if available to test suction function or to clear obstructions. Rigid and flexible catheter measured for oropharyngeal use. Rescuer measures the distal end of the catheter from the tip of the earlobe to the corner of the mouth, following curvature of the jaw to mark maximum distance. Inserts catheter no further than this depth and enter without suctioning. Suctions oropharynx only when withdrawing in a circular motion. Rescuer states, I would suction for no more than 15 seconds for an adult, 10 seconds for a child, or 5 seconds for an infant. I would consider a log roll if there is excessive vomiting. The patient would need to be hyperoxygenated after suctioning. Positive pressure ventilation, endotracheal intubation, advanced life support.
Airway mannequin, Thomas tube holder, endotracheal tube and syringe, stylet.
To begin your endotracheal intubation skill, you need to present the proctor with 3 parts: the ET tube, the stylet, and the syringe. You will push in the stylet. Whether you are working with the adult or the pediatric endotracheal tube, you want to make sure that the stylet does not go past the Murphy's eye. Take your syringe and pull until you reach the number 10. When a cuffed ET tube is used, attention should be paid to the ET tube size, position, and cuff inflation pressure. The syringe holds 10 cc's of air that's pushed in and inflates both the pilot balloon and the ET tube cuff. The pilot balloon will remain outside of the patient. As long as it is full and firm, it is an indication that the cuff inside the airway is also full and firm. To deflate, all you need to do is get the syringe, make sure all the air is out of it, place it on the tip of the pilot balloon, and pull the air out.
Positive pressure ventilation, flow meter 15 LPM, advanced life support.
Connect the BVM tubing to the regulator and then set the flow meter to 15 liters per minute. You do not have to wait for the bag to fill up before you use it. This is a simulated endotracheal tube. The proctor or the scorer will insert the Thomas tube holder with the ET tube and secure it. If for whatever reason the tube is pushed in or pulled out, you need to report it immediately in the field to whomever inserted the ET tube. Your job at this point is to look at the number. It is 25. The next thing you're going to do is secure it with at least 2 fingers and your thumb to ensure it doesn't get pushed in when applying the bag valve mask. At this point, you will provide ventilations 1 breath every 6 to 8 seconds with an advanced airway according to the latest guidelines from American Heart Association. Each breath should be about a second long, and it would look something like this. 1 1000, 2 1000, 3 1000, 4 1000, 5 1000, 6 1000. 1 1000, 2 1000, 3 1000, 4 1000, 5 1000, 6 1000. 1 1000, 2 1000, 3 1000, 4 1000, 5 1000, 6 1000. And you would check for the effectiveness of ventilations by looking at the chest rise and fall.
Positive pressure ventilation, no seal, no chest rise or fall, simulation endotracheal tube. Rescuer presents ET tube set, ET tube, stylet, and 10 cc syringe. Inserts stylet into ET tube and does not extend past the Murphy's eye. Sets the syringe for 10 cc and connects the ET tube to inflate the cuff. The scorer will prepare and insert the Thomas tube holder and modified ET tube on airway mannequin. Connects oxygen tubing from BVM to regulator and set flow rate to 15 LPM. Holds ET tube with fingers to prevent in or out movement while attaching the BVM. Rescuer states, the depth of the ET tube is blank centimeters. I would notify the paramedic if it changed. Ventilates the patient in a smooth rhythmic fashion, 1 breath every 6 to 8 seconds, delivering each breath for 1 second. AHA advanced airway. Counts aloud. Breath squeezes BVM. 1 1000, 2 1000, 3 1000. Rescuer states, I would assess effectiveness of ventilations by observing for chest rise and fall. CPR pocket mask, adult and infant.
CPR mask and airway mannequin.
In this section, we are covering the CPR pocket mask. On the opposite side of the mask is a graphic illustrating how to assemble the CPR mask and how you could use it on a pediatric patient by simply flipping it upside down. You open up the pocket mask case. You bring out the pocket mask. This is the one-way valve, and this is the pocket mask. You will push in to create a dome. This top corner will fit over the bridge of the patient's nose. The bottom part of the base will fit between the patient's lower lip and chin. You assemble it by placing the one-way valve on the CPR mask. You will then place it on the patient. For rescue breathing, you will place your hand in a double CE clamp. You have your index finger and your thumb on top of the mask pushing down. You will use the remaining fingers to grip the mandible. You will hyperextend the neck, and you will provide breaths, 1 breath every 5 to 6 seconds. You will breathe in at the 4th second and breathe out at the 5th second. and you will count 3 rounds, starting with 1 1,000, 2 1,000, 3 1,000. Breathe in, breathe out. 1 1,000, 2 1,000, 3 1,000. 1 1,000, 2 1,000, 3 1,000. 1 1,000, 2 1,000, 3 1,000. That way you're breathing 1 breath every 5 to 6 seconds. Be sure to include a pediatric pocket mask in your airway bag. This kit includes the pocket mask and the one-way valve. This is designed for neonates. The best part about this mask is that it is interchangeable with the one-way valve as well as the bag valve mask.
Rescuer positions themselves at the head of the patient, opens CPR mask case and pushes the center of the mask to dome it out and inserts the one-way valve, places mask on face with apex over the bridge of the nose and the bottom base between the lower lip and chin, places hands on mask using the CE technique, places index fingers over base of mask and places thumbs over apex of mask with remaining fingers under mandible. Rescuer uses upward and forward pull on mandible to maintain hyperextension of neck. Ventilates patient in a smooth and rhythmic fashion, delivering each ventilation over 1 second long. Delivers ventilation at a rate of 1 breath every 5 to 6 seconds. AHA BLS. Counts allowed. Breath 1 1,000, 2 1,000, 3 1,000. Breath in at 4 1,000 and breath out at 5. Rescuer states, I would assess the effectiveness of the breaths by observing for chest rise and fall. Disassemble tank and secure, regulator and wrench, airway bag, oxygen tank.
When it's time to disassemble the oxygen tank, make sure the regulator is on 0. Notice how much PSI you have. You still have 1700 PSI. Take the wrench and turn right. Once it stops, the tank is closed. However, there is oxygen remaining in the regulator. Pay attention to the needle and open up the regulator to allow the air to escape. If the needle moves down, then that means the tank is closed. If the needle remains in the same place when you're listening to the hissing sound, then that means the tank is still open. Once you have bled the regulator, you will put it back to 0. And now all you have to do is remove the tension from the handle, take the regulator off, and secure your oxygen tank in the bag.
Rescuer closes tank valve with appropriate tool. Turns valve right clockwise to close the oxygen tank. Bleeds the regulator valve by turning the flow meter to any number and observes the needle move to the red zone and stop at 0. Turns flow meter back to 0 to shut off. Removes regulator from tank and secures equipment.
This concludes your instruction.
Thank you for watching Lomelli EMS Productions. I hope you enjoyed the training video. We look forward to producing more in the future. Remember, live for today, learn for tomorrow.
Thank you for watching this training video brought to you by Lomelli EMS Productions.